Have you ever heard someone talk about the summer flu? That mystery illness that seems to pop up when the weather gets warm, bringing fevers and sore throats? Well, today we're pulling back the curtain on the group of viruses that are often the real culprit, enteroviruses. And you might just be surprised at how common and, yeah, sometimes how serious they can be.
Welcome to MediByte. We're so glad you're here. Let's dive right in. I mean, if you're a parent, you've probably lived this. Your kid comes home from summer camp or the pool with a sudden fever and just feels awful. Everyone calls it the summer flu, but more often than not, it's actually one of the viruses we're going to break down today.
So here's our roadmap. We'll start with what these viruses actually are. Then we'll look at how they get around. After that, we'll cover the big one, the difference between a normal infection and the rare symptoms you really need to know about. And we'll wrap up with what doctors do, and more importantly, what you can do.
All right. First things first, what exactly are we talking about when we say enteroviruses?
The best way to think about it is that enterovirus isn't one single bug. It's a huge family of viruses with lots of different members. You've got well-known ones like coxsackievirus, that's the one behind hand, foot, and mouth disease, and even the infamous poliovirus, which, thank goodness, is very rare now because of vaccines. So where do these guys like to hang out? Well, they're most common in temperate climates, and their absolute favorite time of year is summer and fall. Right when the kids are all together at camps or heading back to school. They're also incredibly contagious, which is the perfect recipe for outbreaks that can just sweep through a daycare or a classroom. And that's exactly why kids are the ones who get it most often.
Okay, so if they're that contagious, the million-dollar question is how? How do they actually move from one person to another? Let's get into it.
It really boils down to three main pathways. The first one involves swallowing tiny amounts of stool from an infected person, maybe from contaminated food or water, which sounds gross, but it's often just a result of poor hand washing. The second way is touching something contaminated, like a toy or a doorknob, and then touching your own mouth. And the third way is the one we all know well, just breathing in the droplets from someone's cough or sneeze.
So what happens if you or your child actually catches one? What does it look like? The reality is it can range from feeling absolutely nothing to getting really sick. Let's start with what happens for most people.
Here's the good news. In the vast majority of cases, your immune system is an absolute champion. It just fights off the virus and you might not even know you had it. Or maybe you'll just feel like you have a little head cold. But if the virus manages to sneak into the bloodstream, that's when you get that classic summer flu, the whole shebang with fever, headache, sore throat, maybe even a rash.
Now, it is so important to understand this next part. In a very, very small number of infections, the virus doesn't stop in the bloodstream. It can actually move on to attack specific organs.
And that brings us to the serious side of enteroviruses. Now, let me say this again because it's crucial. What we're about to talk about is rare. This is not the typical experience. But knowing what to look for is one of the most powerful things you can do as a parent or caregiver.
The most common of the serious problems is something called aseptic meningitis. That's inflammation of the lining around the brain and spinal cord. The two huge red flags here, the ones that mean you should call a doctor right away, are a severe headache that just won't quit and a really stiff neck. Sensitivity to light is another big clue.
Even rarer than that is encephalitis. And this is different. This is inflammation of the brain tissue itself. This is a true medical emergency. Any signs of confusion, sudden weakness, or seizures mean you need to get help immediately.
You may have actually heard of this one on the news. It's called acute flaccid myelitis, or AFM for short. It's linked to a specific strain, Enterovirus D68, and it attacks the spinal cord. The telltale sign is a sudden weakness or even paralysis in an arm or a leg. It's a very distinct and serious illness.
And it's not just the nervous system. The heart can be a target too. This is called myocarditis. It's inflammation of the heart muscle or the little sac that surrounds it. This can show up as anything from chest pain to, in the most serious cases, heart failure.
This just goes to show you how versatile this virus family is. I mean, look at this list. Hand, foot, and mouth disease? Yup, enterovirus. Herpangina, which causes those awful, painful mouth sores? That's an enterovirus too. It's wild how many different common illnesses are actually caused by a member of this one big virus family.
Okay, I know that was a lot of heavy information. So let's pivot now to the practical stuff, the part where you have some control. Diagnosis, treatment, and most importantly, prevention.
So if you suspect an enterovirus, what does a doctor do? Well, it usually starts with a simple evaluation of the symptoms and a look at any rashes or sores. If they need to confirm it, they can run blood tests or send samples from the throat or stool to a lab. And in those rare, serious cases of suspected meningitis, they would test the spinal fluid.
And here it is, the most critical point about treatment. There is no cure. There's no special medicine, no magic pill that will make the virus go away. All of the treatment is what we call supportive care. It's all about managing the symptoms, like the fever and the pain, to keep you comfortable while your own immune system does the hard work of fighting it off.
So since there's no cure, that makes prevention absolutely everything. And you know what our single most powerful weapon is? It's something you do every day. It's simple, it's effective, and it's just plain old hand washing.
All right, let's recap the big points. 1. Enteroviruses are common, they're contagious, and they love the summertime. 2. The vast majority of the time, an infection is super mild or you won't feel anything at all. 3. In rare cases, they can be serious. 4. There's no cure, so treatment is all about managing symptoms. And 5. The most important one, wash your hands. It is the absolute best way to protect yourself.
So we want to leave you with this question to think about. Now that you know the difference between a simple summer bug and the warning signs of something more serious, what's one thing you'll do differently to help keep your family safe this season?
If you found this explainer helpful, please share it with another parent, a friend, or anyone who might need this information. Be sure to hit that like button and subscribe to MediByte for more clear, no-nonsense health knowledge. Thanks for watching, and stay well.